Hello and welcome to TDL again. To be fair, I'm not feeling fantastic, to be honest, but at the end of the day I'm here ready to go to the gym one more time. Don't know what I'm training. I don't think I'll be covering too much in there. To be fair, I'm not sure why I feel this bad. Maybe it's my vitamin D that needs checking. Then again, my back doesn't feel too bad. Normally my back is the first thing that goes when my vitamin D is pretty low. I'll vlog a little more when I get home, and when I'm in the gym it's going to focus on a few things, so I'll see you inside. Here I am at the gym. It's pretty noisy. I'm not sure what I'm going to train today, but probably going to be a bit of back, but we'll just wait and see. Not feeling great, so I will document that and see how it goes. What are we hitting today? You don't know? Speak up. He's got no voice, he's a tethered. He's one of them people that live underground in a red suit. Yeah, we're going to hit a bit of back, I think, today and see how it goes. I don't know what's wrong, I just feel a bit tired.
No, it's alright that.
Just finished at the gym, and to be honest I wasn't feeling too great, but I thought I'd get a session in there anyway. I think it's very important to listen to your body and understand your body a bit better, and when you're not supposed to push yourself, don't, but try and get a session in as best you can if you have the capability of doing so. But I'm going to get home, shower off and talk to you a little bit more about why I might be feeling pretty bad. I'll see you soon. Welcome back. Thank you very much for sticking with this vlog. I know it's not been fantastic. Obviously I've just been to the gym and I thought I'd come outside, get a bit of vitamin D. Obviously for the reasons for this actual channel and this vlog itself, but honestly thank you so much. So you may have seen the last video last week when I was taking vitamins in the morning as soon as I woke up, and you know, today I want to talk about vitamin D and why I basically take vitamin D. So let's start off. What is vitamin D? I think that's the main thing we should start off for. Well, in short, vitamin D is needed to keep the bones, the teeth and the muscles healthy. Essentially vitamin D helps the absorption of calcium in the body. The body makes vitamin D directly from sunlight, hence the reason why we're outside today. However, if we live in climates that don't have much sun, it can be quite difficult to get your vitamin D, especially over here in the UK between the months of October and March, when the clocks have gone back and we're in GMT rather than BST, which we are in right now, hence the reason why I'm outside. But you can get the vitamin D from the sun, that's the best place to get it. However, certain foods include vitamin D, like oily fishes, red meat, liver, eggs. But don't worry, vegans, foods like mushrooms, almond milk, tofu, obviously a good source of vitamin D, so you can get it as well, which is good. So you saw me the other day take 1,000 international units, which is equivalent to 25 micrograms. The NHS recommends that we all take 400 international units, the NHS in the UK obviously, between the months of October and March, and that's because we're not getting enough sun. which is fair enough, but I guess it depends on where you're living. This is going out on the internet, so the closer you live to the equator, the more sun you are going to get, the less vitamin D you're probably not going to need, right? So why 1,000 international units? Well, there are some people that are deficient and might need a higher strength of vitamin D. So number one would be people with darker skin, like myself. Ideally, with my skin tone, I should be getting more sunlight. I have a rule, and if you genetically belong from a country that's closer to the equator, your skin tone is going to be darker and you need more vitamin D. It's as simple as that. There might be other reasons why you have a vitamin D deficiency. Number two, should I say, people who live in care homes, who don't really see outside, and people who cover up when they go outside. I mean, you generally need more vitamin D from the sunlight, and you're not getting it. So it's to compensate for the lack of sunlight. So I would say have the highest strength of vitamin D. So I'm sure some of you have some questions like, well, how do I know if I'm deficient in vitamin D? Which is quite a good question. And, you know, I'd always recommend you go see your doctor or your pharmacist to check up on your vitamin D levels before you actually start taking anything. But alternatively, if you want to comment below, maybe it's something that I can help you with. But there are, unfortunately, some dangers if you do get your dose incorrect. Earlier this month, and we're in March 2019, there was a trial of 86-year-old care home patient called Eileen Cowles, which went ahead and the doctor had accidentally prescribed a weekly dose as a daily dose. Unfortunately, this patient died from hypercalcemia, which is an increase of calcium in the system which can eventually damage the kidneys and the heart. So please do seek advice from your doctor and your pharmacist, you know, before you start taking vitamin D. So, okay, signs and symptoms. That's what we're going to go on to, signs and symptoms of possible vitamin D deficiency. Well, actually, there's quite a few, but, you know, I just want to go through three because of the type of channel that this is. We're a fitness channel, a health channel, so these are three telltale signs. There's not much evidence with the other ones, so I wanted to use the ones that we did know. So number one would be fatigue and tiredness. I mean, this is normally overlooked because, let's be honest, people get fatigued and tired from different things, and you can put it down to different things. Like, I've had this before, and the last thing I did was put it down to vitamin D. I mean, I was going to the gym, I was going to work, I wasn't getting enough sleep. I put it down to them things rather than my vitamin D. A study by Masoudi et al. In 2013 that was published in 2015 took 200 female nurses and checked their levels of fatigue via a questionnaire against vitamin D levels. Now, nurses from Iran were probably used because, number one, they cover up, number two, the job's indoors, and number three, the skin tone is slightly darker. But most importantly, number four, the nature of the job. I mean, if you're going to be on your feet all day, you're probably going to suspect that the tiredness is due to the job, right? I mean, being a nurse is very difficult. But here's the thing. The results were staggering and found that there was a relationship between fatigue and vitamin D deficiency. 89% of the nurses suffered from vitamin D deficiency. However, I do have to mention that with certain studies there are limitations. I mean, how does one measure fatigue? Number two, muscle pain. Now, muscle pain is very tricky to pinpoint also. The reason for that is obviously as we get older, we're going to have more muscle pain, right? Like, I go to the gym, I'm going to get more muscle pain. Like, that's the idea of going to the gym, right? To actually tear your fibers and allow them to grow, you're going to get more muscle pain. But that's why it's quite difficult. I think if you put all of these together, then, you know, you might have an argument. Also, scientifically, the vitamin D receptor is present in the nerve cells called the nociceptors, which sense pain. A study in Norway by Knutsen et al. In 2010, which took place in a health centre, looked at 572 patients with non-specific musculoskeletal pain, headache and fatigue. Of the 572 patients, many were South Asian, Middle Eastern and African. The results were quite damning, really, because 58% of all patients with pain showed they had a low vitamin D. 83% of them were of Middle Eastern, South Asian, African native countries, but 33% of them were white Caucasian, which brings me back to the next thing. Like, low vitamin D can be prevalent in white Caucasian individuals, right? Of course they can. Number 3, bone pain, and this, in my opinion, is probably the most important one. When I'm in practice, this is probably the telltale sign of whether a person has suspected low vitamin D. I mean, I can vouch for this. When I realised I had low vitamin D, it was, you know, it was that made me get my bloods checked. I mean, my back was always clicking, my joints were hurting when I was putting strain on them, especially with weights. You know, it's quite horrible. It seems as though the back's almost affected every time, and I've got an example here. A study in 2013 by Silver et al. Took 9,354 postmenopausal women with low bone mass and evaluated them all for lower back pain. The median age was 67 and the median age for menopause was 49. The results showed those with a lower vitamin D reported more back pain with those whose levels were within a normal range, and concluded that vitamin D deficiency was related to back pain and its severity, meaning that if you have lower back pain, it's not generally from low vitamin D. However, a low vitamin D level will most certainly make it worse. So there we have it, 3 main signs that you may need to look out for if you think you have low vitamin D. I mean, I certainly knew I had low vitamin D because I knew about it. I mean, hopefully you guys know a little bit more about it right now, but please take my advice, ask a pharmacist or doctor regarding supplementation before you start taking anything. I don't want any of you to get unwell. I mean, that's not what this channel is about. I want to actually improve your health. So if you've got anything you want to add, put it in the comments below. Also, vitamin D3 is what you need and not vitamin D2, because it's easily absorbed. If you wish to take it, then you can take it with fat oils as well, which will make it be absorbed a lot easier. So in the future, I'm going to go through other supplements that I take, like magnesium and the multivitamins that you've seen. But if there's anything else you want me to cover, then just hit me up on the comments below, and I will see you next time. But thanks for now. If you're watching for the first time, please subscribe. If you can't, if you don't want to, that's fine, but hit the like button. I've been Iqbal. Thank you for watching. Baby.